Good morning, and you must forgive me, I do not have PowerPoint slides. The main reason for that is I got called unexpectedly to participate in discussions about the challenges of Ebola, and I arrived back the early hours of this morning. I'm really sorry that I've missed all the wonderful discussions, but just from what I've heard now, it's clear that the struggle for social justice and for redress and for adequate treatment and for the discontinuation of the use of asbestos, that struggle is still very much alive and that it's still going on. We live in a global world of immense inequality, and the tragedies of asbestos, of HIV, of Ebola, and so on, it's part of that world of inequality. And I want to very much echo what Richard Spoor had to say earlier when he said we need to collaborate and we need to work together. Because part of it is that unless we find ways, better ways to work together, we cannot whittle away at the inequality that make it possible for us to still have the problems of asbestos, of HIV, and of Ebola in the way that they are facing us in our world at present. I have worked for many years with asbestos-related, with asbestos-exposed communities. I have seen hundreds, maybe even thousands of them in person as a medical doctor. I have seen thousands upon thousands of records of asbestos-exposed workers from factories, from mines. And so I want to echo very much what I have learned from my years of working with people living with HIV. And they say, nothing about us without us. And I think that's been a major strength of finding ways to turn around the global AIDS pandemic because of the very active participation of people who are affected by HIV. And so from country to country, I have heard this, nothing about us without us. And so I want to say right at the beginning that I think it's imperative in whatever work we do, we work together with people who are affected by asbestos. If we don't do that, we will fail, and history will not absolve us. Having said that, I want to acknowledge a large number of people who've done a tremendous amount of very good work. Every bit of progress that we made is based on the many people of goodwill who have done a tremendous amount of work with regards to asbestos. They're the community members. They are the medical people, the legal people. They are those who write about the history to profile the problems related to asbestos exposure, those who talk about the inequality, who are not hesitant to go out there and find ways to help and to support, because I can tell you a tremendous amount of help is needed. But our conference and our discussion, my dear colleagues and friends, is very far away from the majority of the rural areas where asbestos was mined in this country. And next time when we have it, may I suggest we have it a little bit closer to where they are, so that we can go and see who we are talking about and speak about those we are talking about. I want to acknowledge in the audience here the presence of members of the Asbestos Interest Group, who's been very, very much supported by the Asbestos Relief Trust and the Kgalagadi Relief Trust. It's Mr. Stephen Kotloane, Ms. Prudence Kotloane, and Ms. Lucia Meriotle. And I really want to thank the Asbestos Relief Trust for making it possible for them to be here today and to participate, because they are here carrying the hopes of many, many from the Kuruman area where the blue or cruxidolite asbestos was mined in our country. And as you will all know, and I'm sure as you would have heard from my colleague Jim and others, it really is in a big way the epicenter of the global mesothelioma problem. So having said that, I also need to acknowledge that I have discussed this talk with my colleagues Landi Braun and John Trimber, as well as Sister Elizabeth Nolokwe and Sister Faiza Desai and Tandikayam Gotri, all of them who were part, certainly the last three, in the very, very beginning when we set up the medical panel for the Asbestos Relief Trust. So I want to remember them and acknowledge their contribution as well. Now, you would have heard about the problems related to compensation for asbestos in our country. They are major. In 2011, it was 100 years that we have a compensation system in place for minors' lung disease in this country. 100 years in 2011. But it's a broken system. It's a sick system. It's a system that does not really uphold what we fought for to have in our Constitution for the protection of human rights. A worker can wait up to 5 years for compensation. Now, if you have mesothelioma, it just doesn't happen in your lifetime. So the compensation system does not do justice to the needs of workers. And even when they get it, as Richard said earlier, the compensation they do get is so little. And one cannot help but ask, like the communities are saying in the Kuruman area, we didn't ask for this asbestos to be around us. It is not of our making, you see. So the fact, and my young Mark, a colleague, when he said that it is not nature, so it is man-made, and so we need to find ways to continue to help those who continue to be exposed to asbestos in every possible way, whether they go to school, whether they go to church, whether they go to do their shopping, whether they live in their homes, it's everywhere. And of course we can say maybe people should move away, but it'll require a big movement to say we need to move away, to go somewhere else. So in the interim, what are the things that community members are saying, please, we need? I can tell you their biggest fear are for their children. For their children. Over and over, from village to village, and I was there about 3 weeks ago, you hear them saying, we want something to be done for our children. They never worked in the mines. We have worked in the mines, but our children have never worked. So what can be done for our children? For them, compensation would be that they don't go to schools where the playgrounds, you can still see today the blue asbestos fibers around. You see them, they are there. I'm sure Rob Jones would have presented on it. It's there. The photographs are all there to show it. It's right there. And the fiber levels are there. They don't want that. They want a change from that. But they also want to be part of the solution. They don't want the solution to be made for them. The other big worry for community members with regards to compensation is it's difficult to understand why some people get compensation and others don't. So there's this tragedy unfolding, or have been going on for some time, that people want to be sick to get money. And that is because it's distant rural communities, it's underdeveloped, it's the legacy, it's still part of the history of our inequality from the past. It's partly that, but it's not just that, because we could have done a lot to change things when the mines closed down, to create jobs so that people are not so dependent on that miserable bit of compensation money. That really doesn't bring in any way justice. So they want to see activities happening in their communities that will benefit all of them. That's not just an individual benefit. They want proper medical care. They want to have a CT scan close to them so that they don't have to travel 240 kilometers to have their mesothelioma, to start the process of the diagnosis of the mesothelioma. They want their chemotherapy within that area. They don't want to have to travel when they are sick. And they get the chemotherapy today, and they travel back their 240 kilometers, and they get sick, and they vomit it up, and that's the reality. And that's what they tell you. We don't want that. We want compensation in a way that will help us all right here where we are. So on the one hand, they want their children, and of course all of them who are not affected or who haven't been exposed yet, or haven't got the asbestos-related diseases yet, they want to be protected, and they want prevention, and they want a major focus on that prevention, and they want to be helped with it. They don't they don't just want handouts, they want to be part of the solution of that. On the other hand, they want to make sure that those who are already sick, those already affected, that they are treated with greater dignity, that we do everything in our power to reduce the pain and suffering that they are having and the chronic uncertainty. I can tell you it's enough to make you weep when you hear the parents talk about their children, because they go and live every day. When will the children get sick? There's a request from some of the parents, can all the children be x-rayed? As if maybe there's this vain hope that by an x-ray they will be told whether the children are sick or not. Now transplant that. Just think, when I came here, drove here this morning, I heard on the radio of a doctor who worked in Guinea on Ebola who became sick. Of course, it's a major human tragedy. But all the discussion that all of us throughout the world focus on that, because it's there. But there are hundreds of children in those communities exposed to mesothelioma causing asbestos, and yet their voices are just about nowhere. So that's why I started off by talking about the inequality. We can help to address these things. This conference helps to focus on the problem. But when we look at the solutions, let us dig a little bit deeper. Let us have it closer next time. Let us go visit. Let us engage. Let us adopt a family. Let us adopt a school. Let us see what we can do to reduce this historic inequality that we have. And that's not just compounded by the history, but the current inactivity to really help people to live the rights that's within their constitution. If I have a little bit more time, I want to say it is essential that we celebrate the work people have done, the good things that has come, both nationally and globally, from people who have engaged and put all their energy to find solutions to these exposures and these problems. And you can see it's a complicated issue. But we have to look at how we use our medical expertise. Is it possible for us, when we have future court settlements, that we can write into those settlements things that can benefit communities more? Can we negotiate with their voices much louder? Because I do think that the community voices need to be louder. They need to be supported to organize more effectively and efficiently and join others. Is it possible to emphasize that somebody with asbestos within their lungs